Good day. My name is Nuruddin Rashid from Abuja, Nigeria. I work with National Primary Healthcare Development Agency. First of all, I would like to take this training very important and very serious if given the privilege to be part of this training, and then becoming an infodemic manager would be a very great achievement, as part of my career. I would like to respond to question number 9, question number 10, and question number 9. Firstly, for question number 9, firstly, I will support the Ministry of Health in developing a risk communication plan by specifying the objective of communication, key messages, audience mapping, and message production and channeling. And I will develop 1 or 2 pages hand notes or pamphlet or flyer that will be distributed by the Ministry of Health through the primary care center to the communities. It will entail addressing the following rumors and misinformation about COVID-19. And the rumors are whether the COVID-19 affect the rich. No, it doesn't affect the rich. It does not know social status. Both rich and poor are being affected. Can it be transmitted through hot climate areas that COVID-19 affect other people? It thrives in cold weather, taking hot baths, using hand dryers, eating garlic, drinking warm water with lemon, spraying alcohol and chlorine on the body, taking pneumonia vaccines, and holding breath for 10 seconds, being a test for COVID-19. And also even taking vitamin C. We all know vitamin C boosts immunity. So all these are just not facts that this can prevent or even cure COVID-19. And my second approach here will be by conducting training in the primary care center through the national primary care. Since we know that most of the populace reside in semi-urban area and rural areas where they have access to primary care centers, and the national primary care development agency, to address this misinformation through its health staff in those facilities, the agency should conduct training of health workers by linking services with the community during COVID-19 outbreak using below guidelines. By number 1, by informing the traditional leaders and the community stakeholders and about COVID-19 disease and how the symptoms, how it spread, those in the risk and prevention measures, and solicit for the support of traditional and religious leaders in those communities. Those can help a long way. For question number 10, on the CAP survey, the reason why the CAP survey question should be included is just to identify key driver of misinformation among the populace that COVID-19 is not a biological weapon by the Chinese government, and to assess their knowledge, their attitude, and to determine the level of adherence practice towards COVID-19. And the key question that we're asking here is majorly, to know, number 1, do you perceive that COVID-19 is real and can cause death? Do you perceive that COVID-19 is being transmitted through air droplet, air breathing? Do you perceive that COVID-19 is a biological weapon designed by the Chinese government? Do you perceive that COVID-19 is a symptoms like malaria? Also, are you aware of all preventive measures against COVID-19? And also, how often do you wear masks in the public? Do you practice social distancing? And do you still do handshaking? And what have you? So thank you very much for having me. I look forward to be part of this training. Thank you. Bye.